Yeah, I think ethnicity is really topical, particularly in rare diseases, and not very much data is available across the world. Particularly in the UK, we don't have good data on ethnicity reporting in some of these rare diseases, such as amyloidosis. We know in myeloma there are health disparities amongst ethnicity, so there's definitely rationale for looking at ethnicity. There has been some data reported in the US about differences in health disparities, and some of that's related to socio-demographic factors. So we looked at patients from the UK National Amyloidosis Centre, so that's kind of the major referral centre in the UK, and we looked at all of our patients from 2010 to 2019, and we looked at the spread of ethnicity amongst these patients and compared that to that from the census data, so from the Office of National Statistics. And interestingly, there are differences. In order to think about socio-demographic factors, we use something called the Index of Multiple Deprivation, and that's kind of a composite endpoint which looks at multiple factors which affect socio-demographics. So that might include education, access to healthcare, and other things. And we did find that amongst the ethnic groups for patients who were diagnosed with AL amyloidosis, there were differences in your baseline level of socio-demographic factors. So different ethnicities had different levels of deprivation by that term. We then looked at kind of biomarkers at presentation, and this was really interesting because the NT-proBNP, which is a biomarker that's really important for staging, that was significantly reduced in those from an ethnic minority compared to the white cohort. And that really has major implications, particularly as we use NT-proBNP as one of the key markers for staging patients. We tried to do some further analysis looking at what optimal cutoffs would be for sensitivity and specificity for predicting overall outcomes by ethnicity, and that differed also. In the entire cohort, we didn't notice any difference in overall survival. So there's kind of a lot of food for thought. And I think it's something that is topical, something that really needs to be explored in larger data sets, and something that we're continuing to evaluate, because I think ultimately we know that it's not just one homogeneous population, there's different factors that we have to think about. So that's kind of promising early data.